I am really excited today. I am here with one of my heroes in the medical world. I'm absolutely thrilled to introduce Dr. William Li.
Well, thank you, Dr. Ellie. It's a real pleasure to speak with you. And, while there's traditionally so many perceived differences between what a dentist does and what a physician actually does, a medical doctor, in fact, we do the same thing. We're helping people have overall better health, and we just focus on different aspects of that. So what happens in your mouth? I mean, I think teeth are sometimes viewed by the general public, the consumer, as sort of cosmetic until you find a problem or you have pain there. Similarly, I think people go to the medical doctor and realize unless you have pain in your chest, you don't think about taking care of your heart. And yet the moment you have a problem, it becomes really acute. And so the best way to move through life is to prevent these problems. And that way we can continue to thrive without having to fixate on repairing the bridge after it is on the verge of collapse or has already collapsed, right?
Absolutely, absolutely. I read your book, Eat to Beat Disease was the first one I read. And I just felt so much synergy because as a dentist, I am facing probably what I assume not to be, too forthright, but the difficulty is that medicine and dentistry have gone along channels that have ignored lifestyle, diet, nutrition, all those things. And they've directed everything along a route that works as a Band-Aid, but preventively, it's so bizarre.
Right.
And I was really fortunate to just give you a little background about me.
Yes.
I became a dentist in 1970, Guy's Hospital, London, and decided I couldn't work under the National Health Service, so I went to Switzerland. In Switzerland, they used food. It was the last food in your meal that was important, not so much what you ate. I mean, that was back then when food was food, but it was the conclusion of your meal, the pH, what was in the food. Cheese particularly was very good for teeth. If you ended with some cheese or you ended with whole milk. Then we discovered raspberries, strawberries, all sorts of foods that alkalize your mouth and feed in what we know now is it feeds the good bacteria, develops the protective microbiome. And this is part of what I learned then, along with healing. We used to use, before a wisdom tooth was extracted, we would feed, give the patient a diet with fresh pineapple and yogurt. And of course it was live yogurt, very traditional Swiss yogurt, and fresh pineapple, which has, as you know, bromelain, AKC, everything that we hadn't even no idea back then in 1970. And I was the main extractor of teeth in the practice. I had done a residency in oral surgery.
Okay.
And the difference in healing power between what I had seen in England compared with these patients that were primed for a week before and a week after, it was staggering. And I came to America, I was so excited because I'd been using this then for 10 years and told these American dentists, before you have an extraction or afterwards, you must get your patients on this pineapple yogurt diet. And they thought I was from outer space. It's everything I wish I could do is convince dentists to use more nutrition. I mean, I haven't had a cleaning in 45 years. And my kids, if you get on this preventive program early enough, it maintains the microbiome of the mouth. And
wow. And what is the protocol exactly?
It's really developing young enough that as you suggest, not snacking and eating and confusing your body. Your body is ready to heal. Saliva is super saturated with everything teeth need to repair and remineralize themselves, heal your gums. You just have to give your mouth adequate time for the body to repair itself.
Right. What very, very synergistic ideas, which is really great. And how long have you been in Austin?
I've been in Austin for 10 years. I retired at 65. I was in upstate New York in Rochester. I worked at the University of Rochester. I'm a pediatric dentist. And then what happened is I opened a coffee shop.
Okay.
I had the first cappuccino machine in upstate New York.
Nice.
I went to New York, bought a cappuccino machine because I couldn't stand the coffee. And upstate New York coffee in 1982 was Folgers, I think, the powder with water.
Exactly.
And so I bought this beautiful Reno Gnesi cappuccino machine with the pull handles, hydraulic handle press cappuccino.
Yep, the whole ball of wax.
The whole thing. And I introduced people to Calibu Belgian chocolate, desserts not made with sugar, but with real fruits and, whipped creams. And of course, people thought it was so funny that a dentist would have a pastry shop.
Right.
And I used to talk to them and say, it's not this that's damaging your teeth. And I started the education process within the coffee shop. And then finally, my coffee shop restaurant grew. I had 70 waiters.
Wow.
70 with bad teeth. And so they were smoking cigarettes, they were drinking coffee, they were on the soda fountain with soda. So I used to pH test everything, and I ended up making xylitol mints for them. I knew about xylitol use in Finland, and the waiters they used to have change in their aprons back then. They would put the change in a gumball machine and nibble on these xylitol mints that protected their teeth. And that was how I came. That's the business I run now, is a xylitol mint business. Started in 2002 after 5 or 6 years of helping the waiters with their teeth. You don't need much. I mean, a teaspoon a day is the amount, but just spaced out at the end of meals.
Of xylitol.
Of xylitol.
What is it about xylitol specifically compared to any other naturally occurring sweetener that reduces strep mutans?
Sure. Well, xylitol, like sugar, is hygroscopic, so it stimulates a flow of saliva. That's the main thing. And that stimulated saliva is going to be about 2 units of pH higher than resting saliva for everybody. So if you have a woman, pregnant women always have a salivary pH of about 5. This is why telling a pregnant woman to floss is ridiculous, because flossing isn't going to change the pH or change the oral microbiome. And of course, the oral microbiome.
And why does pregnancy lead to a more acidic oral environment?
I don't know. It does. Like the day you're pregnant, and it changes back once you've given birth.
Wow.
And I only found that out by testing. And women, most healthy men, young men, all the waiters in my restaurant had a pH, their mouth pH was about 7.4. The women, we fluctuate depending on, actually stress is one of the biggest modulators of women's pH.
Interesting.
I would be on the beach on vacation, have a pH of about 7, start packing my suitcase and find that it was a pH of about 5.5, just the thought of going home and what I had to do when I got back. So it's a little bit different, when you come from this other angle. But I don't want to talk. I came here to talk about your books, and I just wanted to give you some background.
No, I'm learning from you, so it's interesting.
Well, I think that there's a lot of synergy. I think that in the world of functional medicine, I was a founder of the American Academy for Oral Systemic Health, and I really believe there needs to be a bigger focus on the impact of oral health on chronic inflammatory disease, everything. I mean, my experience is I can help diabetics, I can help people who've had heart attacks, I can help people at risk for stroke, but it's a different way of helping them from traditional dentistry.
It's a fascinating dimension. Very, very worth contemplating, because people don't think, the consumer doesn't think enough about it, but certainly the dental community isn't also I'm like, as you say, kind of like the medical community, trained to do what becomes familiar and to rinse and repeat the same thing over and over again without opening your mind or really honestly advancing the field, except where industry thrusts some technology or a device or a drug into your hands. And then you go, oh, okay, well, I guess I'll give that a try, hoping to get some incremental improvement out of the field with a new toy. That's how medicine works.
Exactly. And, nobody wants to be the marketing agent for saliva. It's the spit in your mouth and nobody cares about it. And, they're trying to sell very expensive toothpaste now, nanohydroxyapatite toothpaste, which is supposed to have the minerals. Your own saliva is beautifully created to be exactly what teeth need to absorb. It's just nobody's behind that marketing campaign. So you never hear about it. It's frustrating.
You are so right about that. Well, yeah, listen, I'm ready to have a chat about how we overlap.
Well, very much so. I'd like very much to talk about your recent book. I would like to introduce you now officially, and then, just sort of see how it goes through. I think people would be my clientele, the people that follow me. You can talk fairly scientifically. They're used to understanding more than most of the public, I think, about how nature coordinates things. And I think the whole thing of brown fat and stimulating metabolism, they would just get a lot out of that. Okay. And maybe, if we feel there's another time to talk again, that would be great. But let's do this today with your book in mind, because I think it's absolutely eye-opening. I've given so many away as gifts because it's fantastic. And all my kids, I have 5 kids, and they know who I'm talking with today.
Oh, okay. Well, thank you so much. I appreciate that.
So let's get started. If I may I came across Dr. William Li a few years ago. I found his book, which was Eat to Beat Disease. And I read it. I was on a journey up to Montana from Austin, Texas, and it kept me busy the whole way up. And while I was there and all the way back, I've listened to it on the audio. I've read it. I can't recommend it more highly. It's fantastic. And Dr. Li is not only an internationally renowned physician, he's a scientist. He's been the author not only this New York Times best-selling book, Eat to Beat Disease, but today we're going to talk about his new book that he published this year, Eat to Beat Your Diet. I have given away, I'm not sure how many of these books. The part that I am, again, really excited to talk with you about is your part in angiogenesis as the president and medical director of the Angiogenesis Foundation. People who have followed me know what angiogenesis is, because I talk about angiogenesis with gum regeneration. And in order to get your gums to regenerate, we talk about how we can massage the gums to stimulate stem cells, regeneration, blood vessels, healing, wound healing. So anything you can give us in the way of information today about wound healing will be understood and well known, and can be applied for the things that I help people with, people who don't want to go the traditional way with dental work. So thrilled to have you here. Thank you so much. And I would love you to start giving us some of the surprises. I think some of the myth busters are tremendous. And your guide to the grocery store it's changed the way I look at shopping. So
and that speaks to what I'm really super expert in is this field of angiogenesis, which you described, important for regenerating gum and helping to grow gum, and also to help heal injury, whether it's trauma or surgery, both of which are very common in oral medicine as well as in emergency medicine or surgery, for example. Regardless of how our tissue is broken, one of the ways the body naturally heals itself is by growing blood vessels. And the reason is because when your tissues are broken, there's bleeding, and it has to come back together somehow. and it has to rebuild itself in a way that is going to restore flow. So blood vessels are channels that allow the delivery of oxygen and nutrients, what we breathe and what we eat, and it delivers them to every single cell in our body, whether it's a dental pulp or whether it's root, the dental root, or whether it's the gum, or whether it's your kidneys or your brain. These are the same interconnected highways and byways that are in our body. Most people don't know this, but we've got 60,000 miles worth of blood vessels that are packed into the average adult human body. That's so extensive that if you were to pull out all the blood vessels and line them up end to end, you'd form a piece of a thread, like a ball of yarn that would wrap around the earth twice. So not surprisingly, this is actually a really, really critical part of our body. In fact, my research has shown it's part of our body's natural health defenses. You get injured, your defense springs into action to heal and to repair and to get better circulation, restore the circulation. On the other hand, the system also prevents extra blood vessels from growing as well. And those extra blood vessels could be really damaging, or they could be dangerous. If it happens in your eye, they can leak and bleed and you can lose your vision. If they happen on your skin, they can actually grow the plaques of psoriasis. If they happen in your joint, they can destroy your joint, as in rheumatoid arthritis. And of course, if they grow near a microscopic cancer, what once started as something totally harmless, abnormal but harmless, which is these microscopic cancers, once a blood vessel touches them, the cancer can grow 16,000 times in size in just 2 weeks. So it really is a trigger for growth, and we don't want that kind of growth to be happening in our body with cancer. So angiogenesis is a system that defends our health by keeping watch for where new circulation is needed for health, springs into action when it's necessary. We can prompt it and coax it along, as you say, massaging your gums, for example. And where excess blood vessels are growing, our body naturally has a pruning system to prevent those wild extra blood vessels from behaving in ways where we don't want it to behave. So think about it as a country club with a perfect lawn and a maintenance system where if there are bald areas in the ground, somebody comes by and sprinkles the seed so all the grass grows up to heal it. And if there's too many scrubby, weedy overgrowth, then there's a lawnmower, a maintenance crew that comes and just mows it flat so you get just the right amount of blood vessels at all times. And that's really something central to health, but it speaks to something that I care a lot about, because I started in this field looking at the biology of angiogenesis and then thinking about, are there ways that we can develop medicines, treatments to be able to help tame our circulation, grow more where needed, mow down, help the landscaper mow down the excess. And in fact, that's been quite successful. We have 43 FDA-approved treatments or devices that can do this. Some of them are used, in fact, in the dental community as well. There is a human growth factor called platelet-derived growth factor that is used following gum surgery. You may be more familiar with that product than I, but I'll tell you the history of it is that vascular surgeons started to look for ways to heal wounds in people with diabetes, because when the wounds occur on the feet, they can actually become infected, and sure, they can lead to amputation, gangrene and amputation.
Gangrene. Mm-hmm, mm-hmm.
Right. So what was developed was platelet-derived growth factor. So platelets are the cell-like elements in our blood that clot the blood so we don't actually bleed out. But inside the platelet, think about it as a suitcase that apparently doesn't have very much in it. But what scientists have done is open that suitcase and discovered, in fact, it contains lots of these little particles that are growth factors. And these growth factors are, in fact, fertilizer for growing new blood vessels. So this actually entered clinical trial, and quite amazingly, it turned out into a drug that It's called platelet-derived growth factor, BB isoform, PDGF, and it became FDA approved for the treatment of diabetic wounds. Very effective in preventing amputation because you can heal a wound, it won't get infected, and you save the limb. Periodontal community adapted this PDGF to be able to accelerate healing and soft tissue regeneration in the mouth. So, and so this is actually an example of the sharing of technologies and approaches in across the medical field and the dental field.
Yeah.
I will tell you one additional thing that's actually going on is that this idea that, well, if drugs can actually be shared, what about food? And one of the areas that I study are food as medicine, but really medicine more broadly being spoken also involves oral health. In fact, it starts with oral health, actually, because when we eat food as medicine, where does the first place the food goes is in the mouth,
Yes.
right? And whatever we think about gut health, most people think about the colon microbiome, healthy bacteria in the colon. So, and I try to explain gut health and how it affects whole body health, as the gut being 40 feet of the GI tract, gastrointestinal tract, about the length of a Greyhound bus that you might board to take a trip across the country. It's a long, and the average human has that long. And, you know, most of the bacteria that we commonly talk about are in the latter part of that 40 feet tube, the gastrointestinal tract, in our colon, actually specifically in a part of the colon called the cecum. It's kind of like a vacuum cleaner bag in the colon. But in fact, the microbiome is present all throughout. And there's the oral microbiome, which is at the very beginning. So we're not just talking about the tailpipe of the gut. We're actually talking about the entry point, the oral microbiome. Now, gut bacteria, I'm sure you probably were taught the same way as I was. When I was in medical school, my first year of medical school, I had, you know, a heck of a time memorizing hundreds of bacteria without any context, simply to know. At some point, I would also have to memorize drugs and their doses to be able to kill the bacteria, right?
Yes.
It's, you know, one of the banes of the student entering the health professions.
That was the worst.
Pure memorization, right? You know, the thing that we were taught, I'm sure, you as well as I, is that you know, bugs are bad, must kill bacteria, and that's why we have antibiotics, which truly have revolutionized medicine. I mean, thank goodness that we don't still live as we did in the Civil War in the United States without the opportunity to use antibiotics. But I had always associated bacteria, you know, the B words, bacteria are bugs, which are bad. And, you know, when we have to like blow them up, we have to find ways to destroy bacteria. Well, it turns out that modern research, and this is what I write about in both of my books, Eat to Beat You Disease and Eat to Beat Your Diet, is that our microbiome in our GI system, gastrointestinal system, which really starts from mouth, oral microbiome, all the way to colon, lower part of the microbiome, is one of our body's health defenses as well, just like angiogenesis. And but the difference, the unique aspect of the gut microbiome, broadly speaking, is that it's a ecosystem of many, many different types of organisms. I'd be interested in hearing what you know about the number of bacteria in or the types of bacteria in the mouth, but in the gut, you know, the lower gut, we often, you know, cite the number about 39 trillion bacteria are in the gut at last count. Probably a vast underestimate. And it also doesn't include healthy viruses, healthy fungi, healthy archaea, which is another form of life that also lives in our body. In fact, we're really not only human. We're partly microorganisms.
Extraordinary, right? I mean, it's just you can't imagine. I was talking to a skin expert who said that the oral microbiome very much resembles the skin microbiome. It is defensive, at least the biofilm over the whole mouth that connects with the nose and the throat and the ears, and, you know, Oh.
I just had a conversation, by the way, with some wound healing experts, and in the field of wound healing, the term biofilm has always been viewed as something very negative.
Oh, I know.
Want to get rid of the biofilm. Biofilm, we have a new device, we have a new technique that removes biofilm. And I have been trying to convince people. And again, this is part of the what we have to shoulder, I think, for those of us, yourself included, that are trying to get the message of new science out, is that no, biofilm is actually good.
It's wonderful. It's protective.
Protective. It starts out being really good. It's like taking a frog and saying, let's rub all the slime off the frog.
Yes.
No, the frog is protected. It doesn't get infected in the dirty pond water because of its biofilm.
This is the biggest problem, because all of this changed during the Human Microbiome Project, right? I mean, really for oral health anyway, that's when it came out. I think that was 2007 to 2013, somewhere in that range, where all the studies that were showing let's kill, get rid of, scrape off, dissolve biofilm. I know that if you do that, you end up with tooth sensitivity and erosion. Just like the frog, it's going to end up with some serious problems if you scrape all his biofilm off. So
exactly,
yeah. Well, that's wonderful.
So part of our body's health defenses really, is not only our angiogenesis system, but our microbiome, the oral microbiome, as well as the lower gut microbiome. And by the way, I did some research with a professor at MIT, looking at one species. Now, so think about the trillions of bacteria in our gut. We barely have scratched the surface of how many, who they are, what their identities are, what they do. But we're not starting from zero. We do have some incipient knowledge, early knowledge. And I think that anybody who's trying to go into, oral medicine research or human translational medical research, like students going in, I encourage them to jump right into this microbiome field, because I think over the next 25, 30 years, and quarter century, it's going to transform everything we know about health.
But it will change prevention. It may not change traditional treatment plans, but anyone who wants to prevent, anyone motivated to prevent disease, whether it's medical or dental, I think that's where they'll have to go.
And recognizing who are the protective guard of our health, the guardians of our health, is so important, because we don't want to actually compromise those guardians. But I'll tell you, even when you have disease, what we're finding in the area of oncology, I do cancer research as well. It turns out that this defense, which can be eroded away in people with cancer, is so powerful that it can make the difference. Whether you have certain bacteria or not can make the difference between life or death. And so this is not just this is not an optional topic. If you are studying or you're grappling with cancer, this is a necessary topic. So here goes this. So one of the biggest breakthroughs in cancer treatment is called immunotherapy. Immunotherapy is not chemotherapy. It doesn't actually give toxins to kill everything in its path, including cancers. Immunotherapy actually just prompts and triggers our body's own defense system, a third defense system. We talked about angiogenesis and microbiome. In this case, it triggers the immune system, your own immune system. Even if you're in your 80s or 90s, it still works to be able to rear up on its haunches to go after the bad guys. In this case, cancer. Our immune system naturally circulates throughout our body looking for trouble. And when it finds tiny little, those microscopic cancers, it'll actually gobble them up and destroy them, dispose of them. Okay, so the biggest breakthrough in cancer treatment is immunotherapy, because by activating your own immune system, we can achieve something that I never thought I would see in my career. Within the span of my career, we now know that you can actually take someone with stage 4 cancer, end stage, game over traditionally, and you can actually take them from stage 4 to stage 0 in a matter of weeks to months, as we did with my own mother at the age of 80, and she's 88 now, cancer free. if you give them immunotherapy. So this is actually using the body's own health defenses, helping it along to rear itself up. Now, here's the thing. Immunotherapy works in less than 20% of people the way you want it to work. Less than 20%, meaning that 80% of people don't respond at all or very well. And in fact, some people who do respond can suddenly stop responding to the treatment, meaning their tumor goes away and then it comes back for reasons that, until recently, we were just scratching our head. Now we're beginning to see for the first time why people are not responding to immunotherapy. And it has to do with whether or not you have certain bacteria, certain kinds of bacteria in your gut. If you have them in your gut, the microbes will activate your immune system. Your immune system will then respond to the immunotherapy. The immunotherapy will prompt your immune system to wipe out cancer. If those bacteria are not there, this wonderful cascade of events will not happen. And so a colleague of mine, Dr. Laurence Zipvogel from Paris at the Institut Gustave Roussy, studied 200 consecutive cancer patients with various cancers getting immune therapy and looked at who responded and who didn't respond. And she found that the only difference between the people who did respond or didn't respond was the presence of one bacteria called Akkermansia mucinophila. Now, Akkermansia mucinophila is a bacteria in the gut that loves to grow in the mucin. It actually gobbles the mucus that's naturally present in the gut. And people go, that's disgusting. I don't want to hear about mucus.
No, it's very important.
It's so important because, in fact, if you had no mucus if you had no natural, normal mucus in the gut, the poop would not slide down in a normal way. You'd be constipated. It would be stuck. And so think about the mucus, the mucin layer, as sort of like the conveyor belt that helps you keep your digestive system working and to dispose of your waste. Okay. So Akkermansia loves that mucus, and it's very sensitive to antibiotics. So if you take antibiotics, you can wipe it out lickety split. Now, imagine you're a cancer patient and you're going to get immunotherapy, which could potentially save your life and take your stage 4 to stage 0. Okay, this is what everybody wants now. I mean, I can tell you as a doctor, this is what I want for my patients. I want anybody with advanced cancer to go back, reverse this disease to 0. And it's possible to do, but we want everyone to be in that less than 20%. Imagine this patient wound up having bronchitis or potentially even a dental procedure or a cut. They have to go to the emergency room and they get antibiotics. And if you didn't know that this is a bacteria that you actually need and you need to grow back, okay, then you got the treatment, you might not respond. And if you don't respond in the absence of other treatments, you might not make it. And so this is, again,
it's life and death, basically.
Life and death issue. And so, I would be really interested to know, and this may not be known now, but like what other obligate bacteria are obligate for health are present in the mouth. I do know one, and I'd like to hear your thoughts on what else is known and about the oral microbiome. But I do know that another organism I studied at MIT is called Lactobacillus reuteri.
Oh, sure. I'm a huge fan of that. In fact, when patients have periodontal disease, that is the probiotic. You see, everybody's in all these probiotics with billions. And I believe that the idea of L. reuteri makes perfect sense. And I also I have no studies. I'm not the scientist, but clinically, if I can get most people with periodontal disease appear to have digestive issues. Mm-hmm. Often they're on very peculiar diets. They've cut out everything and they're on limited, restricted diets. And I'm not in a position to change that. I would just tell them to read the book, both of your books, and consider maybe they should be more expansive. But I found if I can get their mouth healthy and their colon healthy with adequate mucin so that they are not constipated anymore, that everything is working well in their mouth and their lower end of the digestive tract and the colon at the same time, it's almost a miracle because the rest in between appears to figure itself out.
Because it is a continuum, right? So what's interesting is that there have been clinical trials of this Lactobacillus reuteri I think we're out of Sweden, or at least sponsored by the group out of Sweden that actually have been mastered the growing of this bacteria. And it actually shows that it actually prevents periodontal disease. But I studied it for wound healing in an animal model, for example, that you create a wound, like an experimental wound on the back of a animal, lab animal. And then one group, you just give the regular drinking water that you would hang in a cage with a little metal nozzle, and the animals go up there and lick it. And the other one, you actually load Lactobacillus reuteri into the bottle, and you let them, a different group, lick it. The group that actually has the reuteri in their drinking water actually has twice the better rate, two times the rate of healing of a skin. So one has to wonder what would happen for oral surgery, for example. And the other interesting thing that this conversation is making me think about is, the traditional gut microbiome researchers are thinking, well, the L. reuteri, Lactobacillus reuteri, tumbles down to its home in the gut, in the lower gut, and it stays there to do its magic. It lowers inflammation, improves your metabolism, text messages your brain, all these other things. It talks to your immune system. But perhaps actually, the benefits actually start in the mouth. We don't.
Topical. Might be. I mean, this is where it's so difficult to know. I mean, again, I think that in the mouth, we've got two kinds of bacteria. We've got the planktonic ones floating around in saliva, and they're easily disrupted. They're swallowed every glass of water we consume. So those are traveling. The more firmly located ones are the ones within biofilm. And according to the researchers, 40% of an adult biofilm was the biofilm developed during childhood. So we don't have change of that biofilm. Today everybody's wound up about mouthwash changing the mouth bacteria. Everything you put in your mouth washes your mouth. It changes that planktonic makeup in your mouth. It regenerates itself, and it comes from the nasal passages and the sinuses, and it's going to reestablish that mix in your saliva. But the biofilm on your teeth, that can become dysbiotic, and that's when you have periodontal problems and so forth. That, if it's healthy, would have 40% of your childhood. They call it like a fingerprint. It's very personalized. It's developed, and it doesn't change. It takes a lot, almost unchangeable. I think now forensically they're able to look at people's biofilm and actually match it. If some thief was bitten into an apple or something, I don't know. They say it's very personalized. So who knows? It might be.
Well, it's so fascinating because I do think that while I don't generally recommend supplements over food, if you can actually get those micronutrients and polyphenols from your food, I think that's the most life-enriching way of doing it. I do think that as we learn more about the microbiome, certain probiotics are going to prove themselves to be more and more important, especially since so many of us have grown up in eras where we knew nothing about the microbiome. So we were exposed continuously to all kinds of things that could harm the microbiome.
Yes. So I think that's one of the, that's just been wonderful knowledge. And I think we can go on sharing because it's so much. What I'd love to get to is some of the other myths that I want my followers and people watching this video to hear about. Tomatoes. When I talk about where eat to beat your diet and all the wonderful things about tomatoes, people look at me and tell me that story of, oh, I thought tomatoes were a nightshade. Can you be the person that corrects the knowledge on tomatoes for me, please?
All right, Dr. Ellie. So you're inviting me to go into my shed and pull out the sledgehammer to smash what is a well-intentioned but completely false urban legend.
The tomato legend.
There you go. No, I'm so glad that you have a demo. I often do that because people love seeing this stuff. Okay.
No.
All right. Well, let me just first address that many of these urban legends about toxic foods are coming from well-intentioned sources that are just trying to put complicated things together and make some sense to people. And usually when you actually look at one of these urban legends, false ideas about food, they do kind of make sense, although even if it happens not to be true. So let me tell you the story about tomatoes to help explain why some people have said tomatoes are toxic. They are a member of the nightshade family, and they also have lectins, which are toxic, and that's why you should stay far away from them. Okay, so tomatoes did not come from North America or Europe, despite their popularity in the Mediterranean, like Italy. Tomatoes actually came from South America. And the Spanish explorers way back in the 16th century went and discovered tomatoes that were given to them as a gift by the people that they had met in South America. And the original tomato was not red, such as the beautiful ones you just held up. Tomatoes were originally golden orange, or orange or yellow gold. Okay, and in fact, that's how they were named, because they looked like apples, and they were golden colored, so they called them apple. In French is pomme. Pomodoro. Gold is oro. So the word pomodoro, which is the Italian name for tomato, really comes from what they originally looked like when they're. So they were gifts to the explorers. The explorers brought them back, vine intact with some of the leaves and these golden orbs that were attached to them, and they brought them back to their patrons, their wealthy patrons who had funded their voyages to be able to do this discovery. And so what did the wealthy recipients of the first tomatoes brought from South America do? And these were in Italy and Spain. They thought they were beautiful, and so they displayed them as objets d'art. So they put them on these beautiful leaden pewter trays and displayed them for their guests to see. Oh my gosh, what is that beautiful thing? All right. Little did they know that the acidity of the natural acidity of the tomato would leach the lead out of the pewter trays, and the tomatoes would become saturated with the lead on which they were displayed. So then when the tomatoes were eaten, people got lead poisoning, and they associated, of course, not realizing what was happening, tomatoes being poisoned. So this went on for some time, and not surprisingly, the wealthy or aristocracy that were receiving these tomato gifts would then get them from the explorers, and they would just toss them out the window because they didn't want them in their house anymore. And where would these tomatoes land once they threw them out the window? Right in the yards of the peasants. The peasants then actually grew them up. It was food. They didn't have a lot of money for food, so anything was welcome. And because they did not have enough money to have beautiful leaden pewter trays and to display them, they just cooked them and ate them, and they were perfectly fine. So that's one of the origins of tomato toxicity, when in fact it had nothing to do with the tomato. Number two, what about this whole nightshade thing?
Yes,
well, again, when these explorers actually first brought back the tomatoes, vine and leaves intact. Okay, so how we see them in the grocery store, they're all stacked up like cannonballs. I mean, that's not actually how tomatoes were originally encountered. They had the beautiful vines and the leaves. Well, the early explorers had no idea what these plants were. So when they brought them back to the Mediterranean countries, the patrons, the scientists there, clipped off the leaf and sent them to England, to Oxford and some of these like the Royal Botanical Gardens, to really try to identify what these strange plants were. And they looked at them and they couldn't match it with anything, but it kind of looked like nightshade, belladonna. Okay. And they said, well, there's no exact match, but let's go ahead and send it back. It kind of looks like a nightshade. So this is actually how the entire family of nightshade classification occurred. A nightshade that's poisonous. Now, I have to tell you something about nightshades. I'm a medical doctor, but I really hate myths. And so this is why I use the
myths too.
sledgehammer. So let me tell you, nightshade is a very specific type of plant, but it really belongs to a bigger family of plants called Solanaceae. Solanaceae has now become synonymous with nightshade, but it includes eggplants and all these other kinds of peppers that are supposed to be poisonous. So stay away from them because of nightshades. Let me tell you, there's 2,300 different kinds of Solanaceae or nightshade types of plants. There are a few that do contain some toxins. The belladonna, the actual belladonna plant, it's a flowering plant, does have toxins in it, but the toxins, which is atropine, is actually used by the medical community to treat glaucoma. Okay, and so it's not like don't touch them. It's it's the context of everything, and so all these foods got thrown into this idea that they're all nightshades, and because nightshades are supposedly poisonous, don't eat it. And look at the tomato; it's definitely deadly, and it's definitely poison. Hopefully, I've given some context to all this.
Yes, and tomatoes are so good, right? I mean, that's the problem. It's the exact opposite. You were saying for each one, there was a study they did where the women ate a tomato, right?
Yeah. Well, listen, before we go there, I have to, there's still one more
okay.
rusty nail sticking up in this legend I'm going to smash with my hammer. And that is that tomatoes contain lectins, and lectins are poisonous. Okay. Completely false in a tomato. There are hundreds of lectins that are in existence. Lectins are connectors between cells and tissues. So there are natural lectins in our body, and they're not poisonous in our body, nor are the lectins in the tomatoes poisonous. So there are poisonous lectins. None of them are actually present in the tomato. All right. And so I study vascular biology. I study blood vessels. We use lectins to actually study. I know what the poison lectins are. None of them are in the tomato. In fact, what's in a tomato besides a great source of hydration? They're filled with water. They also are a great source of vitamin C. They also have wonderful carotenoids. These are natural bioactives including lycopene, but also another one called beta-cryptoxanthin. And lycopene has been shown in a human study of 36,000 men that those people who eat more cooked tomatoes actually have about a 30% reduction in the risk of developing prostate cancer. Okay. Now we even know the dose. It's eating them 2 to 3 times a week cooked. How much each time, each serving? About only a half a cup. If we got together, Dr. Ellie, and I cooked you a pasta meal with tomato sauce, and I put the pasta down, I only gave you half a cup of tomato sauce, you would beg me for more. So the point is that you don't need a lot to have the amount of lycopene.
And it works as a paste too, right? I've now got that because I just cook for one, just.
Yeah. Tomato paste is a great way to get that umami flavor. I mean, most importantly, tomato is delicious. You can get it in a tube of paste. It's concentrated, so you don't need very much. You know what I do? I like to cook too. So the pan, little extra virgin olive oil, and you just squeeze out of this tube. It's probably twice the amount you'd have in of toothpaste on a toothbrush. You don't need very much, and just heat the oil and stir it around, and then the tomato concentrate will emulsify and dissolve into this oil. Whatever you cook in that tomato enhanced oil is filled with this lycopene, but also it really creates a nice flavor for any veggie, any food that you want to cook. It's delicious. So research has been done. By the way, there's also tomato powder. There's tomato juice. There's canned tomatoes, crushed tomatoes, peeled tomatoes. So many ways to actually have tomatoes. I love them all. But the key thing is that tomatoes have also been found to help metabolism. So a study from Portugal at the University of Porto looked at young women who were in college and graduate school who did not have weight problems. So these were normal, healthy women who were not struggling with their weight. And these researchers simply gave them uno, ripe tomato to eat before lunch, every single day for a month. That's all they did. And they measured their waist size, they measured their body weight, they measured their metabolic parameters in their blood, their glucose, their insulin sensitivity, et cetera, their lipids. And what they found is that, in fact, eating just one ripe tomato a day, that's it. No dietary restrictions, no workout, no trainer, no gym. Just doing that and eating whatever else they're eating was enough to actually help them start losing weight. The weight loss started at 2 weeks. Their waist size actually decreased, meaning their visceral fat started to decrease. the fat hidden inside the tube of their body, and their blood glucose got better, their insulin sensitivity improved, and their lipids, their cholesterol, triglycerides all improved as well. That's the power of food as medicine.
We're going to get everybody who watches this video eating tomatoes. And you said to choose them in the market, you want to make sure they smell like a tomato, right?
Well, look, I mean, almost all tomatoes actually have lycopene. I like to look for the ripest tomatoes that are in season. So if you are in a sunny clime in the summer months, tomatoes are actually, you can grow tomatoes in a hothouse, greenhouse all year long, but the tomatoes are generally a summer plant in a natural way. Go to your farmer's market and see what's available. Now, if you want to be picky and you want the tomatoes with the highest amount of lycopene, I'll tell you what to look for. Look for a kind of tomato called the San Marzano tomato, Sanmarzano, San Marzano. These tomatoes originated from the slopes of Mount Vesuvius in Italy. And you can find them grown in America, in North America. Some people just grow them. And they actually contain the highest amounts of lycopene, all right, among all the tomatoes. Other tomatoes that are also really high in lycopene are and you see these now, the tomatoes in the grocery store or the farmers markets that are almost black, purple.
Really dark.
Those are really, those dark colored tomatoes, really rich with lycopene. Another secret tomato that is packed with lycopene are cherry tomatoes. They're like little lycopene bombs. They're small but mighty. Okay, so now, how do you actually activate the lycopene to get the most out of it? Lycopene, it turns out that lycopene, if you were to pick a tomato off a vine and eat it like an apple, you'll get some of the lycopene, but it's actually chemically in a form that is not perfectly absorbed by your body. So you don't actually get too much of it absorbed, but you can change that chemical structure very naturally to a form that your body loves to absorb. So the way to do it is you just simmer it. You simmer tomatoes over heat. And like tomato paste, for example, Dr. Ellie, is already pre-cooked. And so it already has this transformation that's occurred, and that's 80% absorbed. And so you really get a lot of it. And if you want to get even more in your bloodstream, tomatoes plus olive oil, whether it's as a salad dressing or whether it's actually a little bit on tomato soup or whether you saute with tomatoes, that actually gets you even more lycopene.
I eat more olive oil now after reading your books, because I was told you shouldn't cook with it. That's another urban legend, right? That I'm shocked. Yeah. Lived for years not using olive oil because of that.
Yeah, olive oil is perfectly fine to use. I generally don't recommend frying with it, but even getting it cooking really hot, I will actually cook in a wok with extra virgin olive oil. You want to get ones that are not too robust in their in their bits. The extra virgin parts. They're little tiny bits of the olives. Those are the ones that will actually burn. Okay, but basically, you simmer tomatoes, you cook them up, you naturally change the form where you can, when you add olive oil, your body will absorb 3 times as much of this beneficial lycopene. So it's fat fighting. It can actually improve your metabolism. It can fight body fat, and in fact, this has been studied. How does it fight body fat, and where does it go when you eat lycopene, when you eat a food with lycopene? Tomatoes, watermelons, all contain lycopene. Papaya, all is lycopene. Anything that looks red, right? Okay, so where does the lycopene go? Well, lycopene likes to dissolve in oil, fatty. It's called fat soluble. It's the chemical way that scientists describe it. And so when you eat lycopene, it goes into your stomach, it gets absorbed in your bloodstream, and then the lycopene is looking for oily, fatty tissue to actually dissolve in. And this has been studied at Tufts University. Lycopene that you eat first goes to your belly fat. Goes right in there like a where it then goes to actually fight that fat. Then it'll actually go to your thigh fat to fight.
Like perfect.
Then it'll go to your butt to fight the butt fat. So this has been studied in young people who are eating lycopene-containing foods. Where do they go first? They biopsy the different areas of fat, and they study the highest concentrations and where they actually go after eating it. So listen, what we've been talking.
Tomatoes need a marketing team. I think we need.
Yeah.
Yeah.
Well, and tomatoes are just one example. I mean, what we've been talking about, for those who are watching this, is really food as medicine. We're going way, way beyond this whole idea of like people waving a frond of kale and say just only eat plant-based foods, or saying tomatoes are good or their tomatoes are bad. We can actually use the power of science to punch through the mysteries of our food and to understand what is not only in the food, but how does our body respond to what you put inside it.
Absolutely. And I just hope we can do this again. And there's so much I want to talk to you about, but I kept you now. And these two books, I hope people will really, both of them. I can't say one is, they're both important, valuable, different. If you're struggling with a disease or an illness, I think anything. I mean, even if you think it's too late, right? If you had macular degeneration, say you've been told you have macular degeneration, you cut out sugar, you're very serious about improving your mouth health and getting your gut health in place, you're taking a probiotic, you're eating and cooking your food at home, what would you tell that person? If you give them any special foods, like off the cuff, that?
Yeah, well, we do know from studies done at the U.S. National Eye Institute that certain natural bioactives found in foods, like beta-cryptozanthin, actually can slow down the process and protect your vision, and dramatically alter the course of disease. And so there's a supplement called Arids that you can actually buy in the drugstore, or you can actually get the same natural bioactives from the foods, the carrots and the radicchio and all these kinds of different vegetables that are out there. And absolutely, if you're struggling with a disease, food is the tool in the toolbox that the medical community has largely overlooked. It's just sort of hidden in plain sight. We've got a whole toolbox of things that can make our medicines work better.
Why do you think that it's got overlooked? It's the same thing in dentistry, I promote xylitol, and it's been used for 60 years in Finland as a public health measure, but most dentists have never heard about it in America. And I don't know why.
I can speak only for the medical side of it, the physician community. Look, I mean, medicine began in the Western world, predating even Hippocrates, who's the best known ancient in modern of medicine, Western medicine. Back then, there were no drugs. Surgery was very crude and dangerous, and most people died. There was no anesthesia, blah, blah, blah. What did they have as their tools? They only had food and lifestyle. They only had diet and lifestyle. And then, some best approximation that mostly were hard to distinguish from superstition until science, the tools of science started to arrive.
Yeah.
And so for millennia, the medical community knew that food was medicine. And in fact, ancient communities in Asia, Chinese medicine, Ayurvedic medicine, they still believe it. They've never changed their ways. I think what happened, when you asked the question, Dr. Ellie, well, what happened? Why? I think what happened is that, the advent of the invention from chemistry of pharmaceuticals that could be life-saving, like antibiotics, which, I do think, neither you nor I are saying antibiotics are forbidden. They're actually life-saving. The problem is that when they're used so profligately and so widely without mind of actually having to restore or protect the microbiome, what winds up actually happening is that I think that from a medical community perspective is our attention wound up becoming diverted away from the tools that have been treasured, hallowed, valuable tools for millennia. Our attention got distracted and pointed towards that pharmaceutical high technology box, where it still is today. The latest gene therapy, the latest protein therapy, the latest this, the latest that. And we've lost our way and in fact left our toolbox back on the path when we got distracted by all this technology. So what's happening now Dr. Ellie, I think is that I think especially the younger generation of doctors that are coming up, probably from dental school as well, starting to have much bigger awareness of their own health and the totality of their own health involving diet and lifestyle. And they're on social media, and they are communicating about other aspects that their elders didn't teach them in school, not yet in a curriculum. So I think that there is a return to sensibility about diet and lifestyle. But man, I think it's been a long dry spell on this, and we still are nowhere near getting back to where we are. So that, what you're doing by getting this message out is so important.
Well, I think it's vital. And again, I think my message to people is be careful who you trust, because in amongst people like yourself who are so valuable, and I can't thank you enough for today, there are the myths. There are the people out there making money selling products that don't work, or fear mongering. So I tell people, try to find somebody old enough that looks like they use their own systems and are successful enough. I mean, and the next thing will be longevity, because, I'm in my 70s planning to live to 120. So I've got to figure this out. So when all your next book, maybe a longevity book, would that be a possibility?
Well, you held up both of my books, very kind of you. And what I would tell people who are interested in thinking about how to look at my books, the first one, Eat to Beat Disease, is sort of the debut about when it comes to food and health. It's not just about the food. It's about how our body's health defenses respond to what we feed it. We feed it something bad, it'll take down your defenses, shields down. You eat something good, it raises the shields. And it's all the evidence and all the foods that can do that. My second book, Eat to Beat Your Diet, is really a sequel to the first one. So if the first one is Star Wars, the second one is Empire Strikes Back.
And the next one?
So I'm actually, I do have another book that I will be writing. I'm still in the early days of putting ideas together. And I do think it will be focusing on this idea of living well as possible for as long as possible. Because I actually think that aging itself needs to be redefined, reconsidered, not as sort of the end of life, but a continuity of health. And this is where, we have we have now the science to be able to help us understand how do we do that. It's not perfect, but it's very exciting. And once again, our diet and lifestyle play such a huge role in getting us to where we want to be.
Exactly. Well, it's been fantastic. Thank you so much for your time.